So we're back again with Dr. Mavani. It's been a week later. So how have you been feeling?
I tell you what, a really good night's sleep.
Good. After the treatment, yeah? Good.
It is a lot more relaxed.
Yeah.
Which is nice. Tightened up again in the last couple of days.
Is that normal? Is that work related? A bit of everything?
A bit of everything. Work related mainly from what I do.
Yeah.
Down and around. A bit from the medical side of things. Just because of the symptoms I have.
Yeah.
And the pain I get from that. So it just all tenses up and tightens up again.
And you were saying you're getting it down?
Yeah, so I had numbness kind of down this side here.
Yeah.
And there really.
And that's gone a little bit, or is that still just
It's got a bit better.
Good.
Start doing some exercises, but it's still there. You still feel the sensation on this side.
Yeah. Okay.
But that's the main thing. Yeah.
So compared to where you were this time last week, it's changed around a bit.
Yes.
Is it as a whole better, worse, or has it gone full circle, tightened back up again?
It's better than it was.
Good.
It hasn't fully tightened up.
So
certainly around here you can feel a big difference.
Yeah. So main areas today still into the neck, upper back.
Yeah.
Yeah. Try and have a look at the arm as well.
It
sounds like it's probably the nerves.
Okay.
We've had a look at your neck last time. I want to try just maybe 10 minutes of cranial treatment today, which you haven't had before.
No.
So just to give you a rundown about that, cranial is a technique.
Okay.
It's a mode of treatment, the same as we can do manipulations and stretches and home exercises. It's a technique we do. It works directly on the CSF, the fluid that surrounds your brain that we talked about last time. Some practitioners will work purely doing cranial treatment, they'll call it cranial sacral therapy, that type of thing. And they can treat all kinds of stuff. So it's a modality of treatment. It's not my go-to, so many of my patients who've been to see me, the vast majority of them will have not seen me do that type of treatment. But for situations like this, if I think it's going to be useful, I'll do it.
Okay.
Very, very gentle. You basically just land your back, you can relax. And essentially what happens is, as we've discussed, there's this pulsation of the CSF around your brain and spinal cord. And you can feel that in the cranium, the head, the bones expand and contract. If there's a disruption in that flow, it has an impact on the rest of the body and you can have all kinds of symptoms, and vice versa. If you have muscle tensions or ligament strains or whatever, that can disrupt the CSF flow, and you can feel it in this pulsating. And the idea is we try and steer it in a slightly better fashion, neutral fashion, simply put. So you can just relax and switch off and have a bit of a doze while I do that.
That's nice.
Okay, so we'll get started.
Thank you.
You still feel pretty tight, and at this stage, half an hour of treatment, and then you've got a full week of working and tension and tightness. It will go full circle. The question is how long. If it happens within the week, then it's a bit tricky. If it happens in a month, then that's okay, because then we've got a bit more time to play with and we can get 2 or 3 treatments in and hopefully have more of an impact. If you say, oh, it felt great after the treatment, it felt good as new, but it only lasted 24 hours before it tightened right back up again, that's obviously a lot harder to encourage it to relax.
See now my right hand is just tingling.
Oh, you can feel it, yeah. Nice and floppy arms, let your shoulders, there we go, that's good. Take a nice deep breath in, and then all the way out. There we go. Oh blimey, there was a big one there, wasn't there? Okay. I thought it wasn't going to go. Relax. Last time push. Relax. Good. So I'm just feeling for this pulsating very, very slowly. Essentially it's just a small expansion and contraction of the skull. Very, very subtle. So treatment number 2 just done.
Yep.
Feeling okay?
Much better.
Yeah? Good. Because at least I almost had a little sleep.
The roots are a bit more relaxed,
Yeah,
I'm a bit dozy now.
So we did the cranial, which I haven't done before, which as you saw was not, you didn't have to really do too
No.
much. Felt okay doing it?
It did. It
Felt alright, yeah?
Again, it was just
bit of time to chill
Time
out.
to relax.
As
Nice.
much as anything, yeah, it's nice. So we're going to do another one, get that third one in. That's when we really should start expecting some results, or some
Okay.
long-term results, as opposed to the short-term bit of relief to actually transitioning towards feeling like we're making some progress and it's going to
Yes.
stay put.
Yeah.
Obviously, the difficulty is going to be the job.
Yes.
Because the dentistry side of stuff is going to be a constant struggle. It will always be, unfortunately. And also the trauma you've had on your neck is going to be a constant struggle. So there's going to be a couple of things you just have to keep an eye on, but it's a case of just not letting it get too bad. But with 2 treatments in, so again, we'll check in next week,
Yep.
see how you're feeling, and hopefully the more we do it, the better it will become, the looser it will stay, and then we can space the treatments apart until really you only need them very sporadically. Yeah?
Good.
Excellent. Okay.
Things going.
Right.